have Jennifer Sundberg from AHS today to talk to us about correlation between nutrition and how that benefits mental health in seniors and their wellness and everything. And like I said at the start of the presentation, she has some really good information on this one, guys. So I think this will be a super beneficial meeting for us today at lunch. I guess without further ado, I will throw it over to Miss Jennifer.
And it's been a pleasure working with you in planning this event. And I'm very happy to be here today. I think what I have planned, I'm pretty sure you'll enjoy it or find it very interactive anyway. And what I want to do for you is just talk a little bit about nutrition for older adults. And really, when we talk about nutrition for older adults, we're looking at, it's kind of a gray area, but really 55 plus is what we look at in general. But of course, older adults go way higher than that. So if you want, maybe before I start the presentation, I'll just tell you a little bit about myself. I'm a registered dietitian, and I've been in Alberta all my life, and I've lived in different cities and a few small towns, including Edmonton, Medicine Hat, Calgary, and I currently live in Red Deer. And I've also lived in a couple rural towns as well. So pretty much all over the province, but definitely a true Albertan. I've been here for my whole life. And I've worked in the area of nutrition as a registered dietitian for over 30 years now. But for the last third of my career, at least 10, 12 years, I've been focusing on adults and especially older adults. So part of my day, a couple of my days a week, I do individual assessments for older adults through the home care supportive living program. And then my other 3 days of the week, I'm working on health promotion events, and a lot of them focus on older adult type things. So for example, I partner quite often with the Red Deer Golden Circle Senior Center, and we come up with programming for the club there. Or I might be working on resources or a new web page for older adults that we're currently working on for older adults. So it's more of a prevention wellness type role for 3 days a week. And today would be considered part of my prevention type role. So happy to be here. Okay, next slide, please, Stephanie, and thank you so much for helping me with this. Okay, my agenda is not too long, but I think you'll enjoy it. So first of all, I'm only going to give a screen, I believe 1 or 2 screens on why food matters and why it's important, especially for the older adult. And then we're also going to talk about or do a little screening session. And I titled it, Are You Eating Well? So what I would recommend, if you can, just have a piece of paper and pen handy, just to mark down points. So it's very easy. You don't have to write a lot. It's just basically marking down your points so you can come up with the score later. So grab a pen and paper if you can in the next minute or two, and I think that will make it a little bit more interactive for you. And then at the very end, I'm just going to talk about some ideas that I have based on the nutrition screen. We'll talk about resources and hopefully end for a little bit of discussion or any questions that can come up after the presentation. So really, and we're a small group today, so we can make it really laid back and personal, and I hope you really get something out of the little session today. So next slide, please, Steph. Okay, to start off with, I want to show you this little screenshot that I found it's from the Canadian Malnutrition Task Force, which is a national organization that looks at preventing malnutrition in older adults. And this poster that they have here is called The Hidden Impact of a Poor Diet. And we do find that overall inadequate food intake over a long time can have many impacts for the older adult. And some of these impacts you will see in the magnifying glasses. And one of them I want to point out is the loss of independence. My work in home care has really highlighted this importance for our older adults, how independence is so important to them. And we know from data and research that's being done, and a lot of it's being done by the Canadian Malnutrition Task Force, they do find that loss of independence can occur if somebody is not eating a well-balanced diet. And I can't tell you how many times I've assessed people and found, for example, protein intake's quite low, or the fluid intake is a struggle. And a lot of these circumstances are due to health conditions, or it could be also due to isolation, or meaning lack of transportation, or physical disabilities that limits them from getting out. But there's a lot of factors that affect our nutrition, but the biggest impact we see is the loss of independence. Okay, next slide, please, Steph. Okay, so nutrition screening is a process where you ask specific questions to see if you may be at risk for becoming malnourished. And when we say the word malnutrition, what I have found in the past several years is that people often think of that word and they think of third world countries. But in fact, malnutrition goes on in Canada as well. And what we see often is a slow loss in muscle and a slow loss in outer layer of fat in our body. And over time, when this continues to occur, we see changes in the body that shouldn't be happening. And that's where we might see muscle wasting, which can lead to, example, falls, or we might see somebody who's not getting enough nutrition, and it might be, for example, not enough fluid. And that's where we often see confusion or dehydration, which can lead to increased exacerbation of infections. So malnutrition from this point of view is when we're not getting enough nutrition in the long run. That's really what we're talking about. And mal basically means bad. So bad nutrition, but it's not really a very friendly way of saying it, that's for sure. So what we do to prevent malnutrition and to keep people well is nutrition screening. And nutrition screening is a process where we ask specific questions to see how the older adult is doing. So I want to highlight that nutrition screening is not a full nutrition assessment. It's just a way to gauge if there are any red flags that in somebody's eating habits that could be perhaps improved a little bit. Or maybe they're doing just fine. It just gives you a little test to see how things are going. And in Red Deer, as well as in a couple smaller communities, Olds and Sundberg, we started a pilot project where we have community agencies that do screening for us. And some of these agencies are still doing the screening today, and it's been about 4 or 5 years now. And they're finding that it works really well within their programming. Nutrition screening can also be done by an individual. So there's 2 ways of doing it. Of course, probably the most effective way is if we can do it collaboratively within an agency or within a program would be the best way to do screening. And the other thing I want to mention about screening is the questions weren't just haphazardly picked on by dietitians, you know, saying, oh, this is a question we have to ask. This is an important question. There was a lot of research behind the questions that were asked, and the questions were designed and chosen by a lady out of Waterloo, the University of Waterloo, and her name is Dr. Heather Keller. And I remember her doing this work back in the 90s. So she is still doing this work, and she's part of the Canadian Malnutrition Task Force. So the questions are validated and reliable. So Stephanie, if you wouldn't mind just doing one more click, and then they'll see the topics. So the screening that we do with older adults are based on these topics. And I want to point out that Dr. Heather Keller's validated tool looked at the first 8 questions. In Red Deer, Olds, and Sundre, when we did our pilot, we also found out that our communities were very interested in also finding out if some of our older adults are having trouble making ends meet, or if they're having any difficulties getting groceries. And that could be, for example, due to lack of transportation, or it could be due to health issues or mobility issues, those kinds of things. And because they were so interested in these topic areas, we added them onto the screen. But because they're not validated questions, we don't put a score to them. And this will all make sense shortly as we go through the screen together. So what I'd like to do right now is, and of course it's voluntary, and I won't know if you do it or not, but I'd like to go over each screen question together as a group and have you all answer the question. And when I do this presentation in person, I never get people to share their answers. It's really a tool just for yourself, or if you end up using this tool with somebody else within a program, it's very private. So they don't have to share the information beyond anyone without permission. You know, we do have some people who screen in Red Deer on behalf of the older adult, and they do get referred to the dietitian or the doctor, but it's really based on consent of the individual if they want to go that route. So what you're seeing now is hard to see, but don't worry, I'll break it down. It is the actual screen that we use in Red Deer in some of our screening programs. Like I said, there's the first 8 questions that are scored, and then at the very end, we add on the last 2 questions. And then, of course, when you are screening, you can't just leave people and say, oh, you're having trouble with this. I'm sorry about that. Try and figure something out for yourself. No, we don't do that. We have, to go along with the screen, we have what we call a wayfinding tool for screeners. So if somebody has a concern in a certain topic area, we have resources, classes, videos, and referral forms for the screener that they could pass on to the older adult if they're having that trouble. So that's something to keep in mind. We've set that all up ahead of time in our area. We also have in place our outpatient dietitian who is fully aware of these screening processes going on and knows that she could be getting referrals based on the screening assessment and a referral that's sent in to her. So that's all been set up. And if this is something that your community might want to do, there's lots of help and support to help you with this through our public health dietitians throughout the province. Okay, so are you guys ready to screen yourself? You don't have to be 55 plus, but I thought it might be a nice way for you to actually take a look at the screening tool. So if you have a pen and paper ready, and if you are comfortable doing it, I recommend or suggest that you just write down your score after each question. And again, you don't have to share your answers. And also what I want to point out is you will have access to this screening tool as well as other resources and this presentation at the end of the session. So if you don't quite catch everything, you'll have it at the end. So I think we might be ready to go if we want to go to the next slide. Stephanie, please. And this is question 1. And I'll just break it down to you for you. But what you need to do is just check off one box that best describes you. And then you will see straight across the point value for where you checked off. So for example, the question says, has your weight changed in the past 6 months? And I say, yes, I gained more than 10 pounds. So then I have 0 for that question. Okay. So depending on how you answer, you'll get a different score. So just write down your score. And one thing I get questions about for this specific question is, does it matter if I'm trying to lose weight or not trying to lose weight and I've lost weight? No, it does not matter, because anytime you lose weight, whether you're trying or not, we all lose a little bit of muscle. Okay, so just answer objectively if you've lost or gained weight. Okay, does anybody need more time? No. Next slide, please. Okay, this is question 2 and 3. Question 2, do you skip meals? And again, you have 4 options there. Never or rarely, sometimes, often, or almost every day. The next question, how would you describe your appetite? Very good, good, fair, or poor. And again, just give yourself points for each question. Okay, next slide, please, Stephanie. Do you cough, choke, or have pain when swallowing fluids? So this question is particularly about fluids. Okay, so you could pick never, rarely, sometimes, or often, or always. Okay, next slide, please. Next slide, Steph. She might have stepped away.
Sorry, my screen progression is
Oh my goodness.
working for some
That's okay.
reason.
If it doesn't work, I can read it to you to see if it goes or not.
Yeah, maybe read it to people. I don't know why. Oh, there it goes. Now,
Okay.
okay, let's go back. All right, there we go.
Okay, thank you. So the next question is, how many pieces or servings of vegetables and fruit do you eat in a day? And when you think about a serving, think about, a medium orange, a smaller banana, a medium to smaller apple, or like a half a cup of canned or frozen fruit is about a serving, or 1 cup of tossed salad. Those are all considered one serving. So you can add up how many servings you think you have a day. A half a cup of unsweetened juice is also considered a serving. Okay, next slide, please. How much fluid do you drink in a day? So we're looking at a cup, meaning 250 mils or 8 ounces. Okay, and we're including all fluids here. So you see my pictures there. I have coffee, tea, milk, water, juice counts as well as soup. So when you total everything together, just make your best guess, because I know we don't track everything we drink or eat in a day, but generally, how much fluid do you drink in a day? I often get questions about coffee. Why does coffee count? And years ago, when I started as a dietitian, we never counted coffee because it has a little bit of a diuretic effect where you actually lose some water when you drink coffee. However, the amount is negligible as long as you stay below Health Canada limit of 3 8-ounce cups a day. Not 3 mugs a day, but 3 8-ounce cups. An 8-ounce cup is hard to find these days. They're not that big.
For a
But
second, Jennifer, I was so happy that coffee was included, and then when you said 8-ounce cups, it all went downhill from there.
it's hard to find an 8-ounce cup. They're usually 10 or 12 now. But Health Canada does say up to 3 8-ounce cups of coffee or caffeinated drinks is our limit per day, which is considered safe, which is
So
good for me too. I love coffee.
what if your coffee is like an ounce of espresso,
Yeah.
like a bunch of ounces of milk with it?
Oh, if it's just an ounce of espresso, I don't have that memorized or anything, but it's an ounce. It might be close to the same caffeine content as a full 8 ounces, depending on how strong both are. But if you're adding a bunch of milk, that's great. It's going to make it more nutritious, that's for sure. So consider that as one serving of caffeine per day.
You're saying
And
I
if you
can
want
go
more
have another cup
caffeine
of coffee
information, just go to Health Canada. I would just Google Health Canada caffeine and you will see what it says. It's pretty, and it gives you more ideas of what foods have caffeine. But generally, we do allow coffee as our fluids. Okay, next question. Do you eat one or meals a day with someone? I'll let you answer this and then I'll tell you what people often say to me. Often, what is said to me and to my other colleagues is this question isn't fair. I'm getting singled out because I live alone. So, this is not meant to single people out. The reason why this question is on here is it's because of research that shows that when we eat alone, we don't tend to eat as well balanced meals and we don't tend to eat as nutritiously. So really, it's just a little bit of a red flag if you live at home alone, that you might just have to be more mindful on the foods you choose, or being more mindful of trying to make some more meals more social. So it's not to pick on people, it's just based on research that we tend to eat better when we eat with others. Again, this tool has been validated, and that's why this question's on here. But some people increase their malnutrition risk because of this question. Having said that, this is only a screen. It's not saying you are malnourished. It's just saying you could be at risk.
I think the
Does that make
relevance of
sense?
this one, Jennifer, goes across all age ranges. I would say the relevance of this question, because even I find
Yes.
myself, if I'm eating by myself, why cook a big nutritious meal for just myself? But then if I
Yep.
have my kids and my girlfriend there, obviously I want them to have nutritious meals. So yeah, I think this goes along with almost every age range, I would say.
I agree. Anybody can fill out this tool. It was only validated for 55 plus, but you are so right. Anyone can fill it out and get an idea how they're doing. That's a good point, Chris. Thank you. Okay, next question. Okay, which statement best describes meal preparation for you? So the first three boxes are if you do most of your cooking. The last two boxes are if someone cooks for you. So, but you're only still filling out one box. So whichever one seems to suit you best. Okay, next slide, please. Okay, so please add up your score if you were calculating them or keeping track. And then I'll explain this slide in a minute. So when we did this pilot a few years ago, but we're still running it here in the area where I live, we added in the moderate nutrition risk. And we added that in because we found that a lot of people who were filling out the screen, they weren't really high nutrition risk, but there were still some things that they could work on. So we created this moderate risk. And with our pilot, we screened 276 people, and 60% of them were considered moderate risk. So there were a few things that they could work on, but their nutrition wasn't too bad. 8% were high risk, meaning, and a lot of that came from a lot of unintentional weight loss, living alone, they don't enjoy cooking. There was just a lot of things going on, or maybe they're choking. And then the rest of the people, in a 30-some+% were low nutrition risk. So their score was pretty high, so 38 and above. So depending on where you are, with our screeners, we have this little flow sheet, and it does say some suggestions on what you could do based on their risk level. For anyone who's high risk, we do ask the client if they want a one-on-one appointment to talk about their nutrition with someone. And we set this up in advance in our communities for those who are screening, where, like I had mentioned before, the dietitian is available to help them one-on-one. So we're not just leaving them hanging, saying you're high risk. You know, we're not going to send you anywhere. We always offer help. And even with moderate nutrition risk, if there are some specific areas that clients have issues with, they're still able to see the dietitian, or for sure call the dietitian. And low nutrition risk, often what happens there is just reinforcement. We offer pamphlets and resources if there was something specific they had an interest in with the questions they were asked, and then they go on their way. But again, if there are any questions, we do recommend 811 for them. But this is all laid out so that clients are followed up no matter what their score is. Okay, next slide, please. So earlier I mentioned our communities, when we were doing the pilot, also wanted to ask about if the clients that they see, if they had any difficulties making ends meet at the end of the month, or if they had difficulties getting their groceries. So if our clients said yes to one or both of these answers or questions, then we would guide them to supports within the community to help them out. So for example, question 10, do you have difficulty getting your groceries? We have given, for Red Deer where I live now, we have a list of supports in our community that may help them get their groceries. So for example, meal programs, Meals on Wheels, delivery services. Some of our grocery stores do deliveries for seniors. Many of them do now. Restaurants even do deliveries. Who else do we have on there? Oh, Drive Happiness. They and some volunteer drivers at the Golden Circle that will take people to get their groceries. And if clients have difficulties making ends meet, that's not something that can be handled probably in one meeting. But often one thing that we recommend, if they're having trouble, then maybe they need to take a little peek further at to see if they can maximize their income. So oftentimes people or older adults are unaware of all the benefits that they may be eligible for. So we often recommend that they go to a local senior center or to a tax clinic to make sure that they are getting all the benefits that they should be getting. There's also a website called benefitswayfinder.org. I'm sure many of you have heard of it, but you can take a look at that as well. It asks you questions, and then it shows you what benefits you might be eligible for in Canada, and in particular for Alberta. So it is an area that we do recommend that's looked at as well, because food insecurity is not just a food issue, it's often an income issue. And if we can bring up the income of our older adults by making sure they get all the benefits they are supposed to get, we can really help them in their quality of life. Okay, so now what time are we? We go till 1. I think I'm just going to slide through these quickly, but the next part of my presentation are just some tips that we may give older adults. However, if you or someone in your community wants to start screening, we have all this information ready for you to go. So some tips for gaining weight, or if someone has a poor appetite, we often recommend high protein foods and higher calorie foods. And I often say, as it's said here on the screen, small amounts can add up. A lot of times I'm fortifying foods with my clients so that they're not necessarily having to eat more, but we're just adding more bulk nutrition into their food. So for example, in yogurt or in milk, I have several of my clients that we add skim milk powder to those items just to boost up their nutrition, their protein, their calcium, etc. But we want to look for high protein foods and high calorie foods that give you more bang for your buck. Next slide. And you can keep going, keep clicking a bit through the whole thing. So often people have decreased appetites. So a few tips I've mentioned here on the screen. So really eating smaller meals more often. Eat when you feel the best. Get some fresh air to stimulate your appetite. Keep foods ready in your fridge. I don't know if anyone's heard of Fresh Prep or Heart to Home Meals, or even Meals on Wheels if you have it in your community, but they have meals that are ready to go that are handy. And as well, fluids, I often mention this, drink your fluids in between meals, not right before you eat, because sometimes fluids can fill us up. Next slide. Fatigue is often a reason why we don't eat or don't eat enough. And so consider some partially pre-made meals when you're making food. Ask family and friends to help you. Cook and eat when you have more energy. I know for me, that's first thing in the morning. And consider using programs in your community to help you get your meals. Next slide. And you can click through. So if someone is having trouble chewing or swallowing, the first thing we say, and especially if it's liquids, always go to your doctor and get that checked out. And hopefully in your community, you can be referred to a speech language pathologist, but definitely get it checked out, because what happens is if you're having trouble swallowing, there's a potential it can go into your lungs and cause infection. So we don't want to see that. For food, you want to make food softer to eat and to make them easier to swallow. So there's just some suggestions here on the screen that we often recommend. But again, each person's different, so it's best to talk to your healthcare professional about this area. Yeah, avoiding distractions and getting your dentures checked as well, and going to the dentist. Next slide.
Oh, we have a hand up.
Chris is.
I remember when we were going through the screening application there, Jennifer, you said something about there was a question about fluids being hard to swallow.
Yes.
What would be the major complication that would point to if fluids are hard to swallow?
It may possibly mean dysphagia, which basically means well, there's various different reasons for dysphagia. Basically, it means hard to swallow, but you could have weaker muscles in your throat area that's making it hard to swallow, or you may have a medical condition that's making it hard to swallow, such as Parkinson's or a previous stroke or dementia. So there's some changes that happen in our throat area that can make it hard to swallow. And fluids are usually the first things that people have trouble with, if that makes sense.
I wouldn't have guessed it, but yeah, that makes perfect sense. I wouldn't have guessed that fluids are the first thing that are hard to swallow for people, though. That's very interesting.
Yeah, it's because we can't control them as well in our mouth. They can trickle down the sides, they can trickle all over. You can't make them into a ball or a bolus, so they trickle down.
I
Preet,
see
Julie,
Preet has
another
her hand up
question
too.
for Preet. Yeah.
sorry.
Yeah, sorry. The other thing I noticed, because I had COVID pneumonia, and I remember when I couldn't even swallow fluids. It was almost like choking. I would choke, and then, yeah, it would dribble on the side of my mouth. So
Okay,
even
what
if
did you
someone
do
had,
for it?
no, because I was in ICU for a month. So
Oh,
when you have COVID pneumonia, I got COVID pneumonia because I have a kidney transplant and it failed. So that's why I was in
oh,
ICU. So
sorry.
that's why it's like relearning everything. So slowly, the brain got it, and everything fell in place. It's like you're being born again. That's the best way to
Oh,
say it. But yeah.
oh, thank you for sharing that. Yes, it's a long process for sure if you have to go through that. Okay, so there was a question on vegetables and fruit. So this is big, not getting enough. On the screen here, I just have some tips to get a little bit more in the day. I had one lady say what she does is she chops up a whole bunch of vegetables. She puts them in a glass jar in her fridge and she uses them throughout the day. She adds them into soup, to stew, to her sandwiches, into salads, but she just has them ready. And I find if you have vegetables and fruit ready, you're more likely to eat them. But please keep in mind, there's nothing wrong with frozen fruit or canned fruit. They're just as nutritious. They're picked when they're ripe. You just want to make sure that you're trying to limit sugar and salt if you are picking the canned versions. And the next slide, please. So March is Nutrition Month. So it's perfect timing that we're on today on Nutrition Month. So at the end, I have a handout to give you. And this year's Nutrition Month is on vegetables and fruit. And I think our colleagues said 80% of Albertans aren't getting enough fruits and vegetables. So on this webpage, there's some really good ideas, especially there's a nice little calendar. You can't really see it here because this is a screenshot, but on the bottom right, there's a little calendar, there's a little display, there's newsletters. So afterwards, take a peek at it. It's a really nice page that I'll be giving out to you. Next slide. Okay, and you can just keep clicking through these. So this is a big issue for many of my clients. I find if they're not getting enough, they're getting tired, they're getting dizzy, they don't eat as well, they're getting constipated as well. They could also be, did I say dizzy? They're getting more dizzy. It also makes it hard for infections to clear up without fluids. So if someone has an infection and is not drinking enough fluids, it could lead to delirium as well. So we need to make sure you're getting enough fluids. So often what I see for my residents is they're keeping fluid handy. They're keeping it at their bedside, or they're keeping it beside their lazy boy chair and changing it every day. Myself personally, what I do is the first one, I drink water as soon as I get up, just get myself going. Some people set reminders, whatever that might be. I had one lady I saw yesterday. She had 4 cups. Oh, thanks, Krista. She had 4 cups of fluid set in her room. So she was and her goal was to have them to drink them by the end of the day. So that's in addition to the fluid she was drinking at meals. And some people add flavor. And we mentioned also to keep the fluids nearby to make you drink them more. So what if you live alone? The first tip is have a nice atmosphere for yourself. I had an older lady in her mid-80s who still cooked a hot meal for herself, and she still sat in her dining room, and she made it very pleasant. However, if you want to eat with other people, there's some things you can try. The second one came especially during COVID, where you have phone or video call dates during a meal. But you can also try potluck, supper clubs, community meals, or start a regular community meal with neighbors or in your condo or on your block. And also cooking with family members or neighbors, having a little cooking club together might help. So there's various ways of not eating alone every single day, every day. Next slide. And I think we're going to go through these pretty quick, so I'm not taking up your time. But just to make cooking easier at home, you need to have the foods in your house. So here listed are some things that are easy to make meals, especially if you don't want to do a lot of cooking, to have some of those staples in your fridge or in your cupboards. Next slide. We do also have a lot of quick and easy meals, and so I will share those with you if you want to keep going. This is a really neat one. You can actually Google sheet pan meals. It's where you cook everything on one pan and it's ready to go. So not a lot of mess and easy to make. You just add seasonings and different vegetables, grains, and meats. And also using one pot to make all your meals is another easy way to cook. And the nice thing about these is you can save them for later on. Some people think all your meals have to be hot, but why not consider livening up your sandwiches? So this slide shows just how you can add different foods onto a sandwich, a pita, or a wrap to make it tasty, and also something that isn't a lot of effort either. You just need to have some of these things on hand. And make ahead meals. I love these. And these are more like salads. So again, they're non-cooked meals, but the first one is like a tuna salad. Oh, I see Sandy's got to leave. Thank you, Sandy. We will finish up. And the second one is more like a Mexican salad. So again, no cooking involved. Next slide. It's also okay to have proteins ready to go. So you don't have to cook everything from raw meat. You can have things ready to go as well for your proteins. Things that are easier like eggs or lentils, rotisserie chickens from the grocery store, or frozen meatballs. Next slide. And also another thing I like to do is cook extra meat and save it for later to make other items. So half the meal, I find half the meal that's hard is making the meat. But if you can get some things cooked ahead of time, whether it be meatballs, ground beef, chicken slices, and have them ready, then you can use them for other recipes. It makes it really quick. Next slide. Another thing to have on hand is cooked brown rice. You can add it into a lot of different foods. You can also freeze cooked brown rice. And egg bites. We came up with this idea, and then a month later we saw it on Tim Hortons. But you can make these yourself, and they're great for breakfast. They're great for evening snacks or anytime, just to get a little extra protein and vegetables into your diet. And other resources, and these resources are so important, especially if someone's having difficulty accessing foods because of transportation or mobility, or maybe perhaps because of income. I do recommend 211. If you're not sure where to go, phone 211. They are full of resources and where to go in your community. So they might be a really good starting point, as well as Chris might have other ideas, but there's lots of different options. These are more generic because it really depends on each community. And if you decided to do nutrition screening in your community, we could set this up. A public health dietitian could help in the community to make sure you have everything set up with what you have available to help with screening. And again, just a few more topics here. If you're looking for a nutrition handout, these are two great sites. Healthy Eating Starts Here is from Alberta Health Services. I think there's over 300 nutrition handouts at that site that you can find. And as well, for the screening we did today, there is a handout on every topic we discussed. So you can go to olderadultnutritionscreening.com, and that is Dr. Heather Keller's website. I think there's just a couple more slides. Oh, these are recipes. So recipes from Alberta Health Services. And I really like Health Canada's food guide recipes. So take a look at those as well for more ideas. And if you want more information on nutrition screening, you can go to our webpage on Alberta Health Services, and it's at the top of the page there. And we also have a really short video. It's 4 minutes. Take a look at that video, especially if it's something you think you want to start in your community. And I think the last one is 811. The last slide.
Freezing again. I don't know why it's doing that today.
That's okay.
Call 811, folks.
811 also has a dietitian. So if you aren't aware of a dietitian in your community, let's say you filled out the screen and you're not sure where to go next, you can always call 811 and ask to speak to the dietitian. You can also go to 811.ca and fill out a form and they'll call you back. So they're not an emergency service. It might take them 1 day at the most, 1 or 2 days to get back to you, but you will get your answers. So worst case scenario, if you can't find a dietitian, because there's quite a few less of us than say nurses or doctors, you can always find one through 811. But we are, the public health dietitians are settled throughout the province and they cover all different communities. So if you're wondering who your dietitian might be or your public health dietitian, you can always contact me as well. And I think on the last screen also, Stephanie, I just had my handout and I gave this handout to Chris to hand out to all participants. So I've given him my PowerPoint and I've given him a handout, a 1-page handout of resources, full of videos, handouts, everything that you could ever want regarding older adult nutrition. It would be a great starting point. And I think I will end it there. And
Yeah.
knowing on my very last slide, I also had my website. I don't know,
Sorry,
you're welcome to.
Yes, let me try again. It just wanted to stay on that slide here, but I have this there. Here's the page.
Yeah, or Chris, it's on the PowerPoint I'm sending out as well.
For sure.
So people can get a hold of me. I'm on my email every day. And you can take a look. This is the handout everybody's getting.
Mhm.
And that's 811.
Yeah, so these are the slides it wasn't letting us see.
Yep.
Perfect.
So thank you.
Thank
We're
you
down
very
to
much.
5 people. Thanks for
Yes,
staying, Carolyn and Preet and Chris and Stephanie. And it's nice to have you. And if you hear of any communities that have a program that want to start screening, please let me know. Oh, the other thing, please let everybody know that our screening tool is going to be online as well. So communities can either do it on paper or they can do it online. Seniors can do it themselves or a program in a community can do it for the seniors. So there's many ways to screen. What we want to do is keep people well. We want to keep them in their own homes and keep them as well as possible for as long as possible. And we know nutrition has a big part of it. So thank you.
Yeah, thank you, Jennifer. That was wonderful.
Thank you.
Yeah, thanks so much for doing that for us today, Jennifer. I really appreciate it. I'm sure that everyone got a lot of useful information out of that one for sure.